I'm excited to present the progress that I have made for my kinetic capstone project entitled Teaching Medical Students Laboratory Medicine. I've collaborated with Drs. Patrick Boy, Aaron Preliger, Alexandra Harrington, and Julie Jorns on various components of this endeavor, which has developed under the mentorship of Dr. Marty Muntz. As a practicing hematopathologist, I'm passionate about the role pathology and laboratory medicine play in a patient's care. While pathology serves as the foundation of medical education as it is taught as a basic science, there is limited dedicated exposure to pathology as a clinical specialty in the medical school curriculum. Furthermore, as more medical school curricula move towards a systems-based approach, the footprint of pathology becomes less and less, despite the key role that laboratory medicine plays in establishing a patient's diagnosis, and in turn, guiding the care they do or do not need on the basis of that diagnosis. To give you some background on my capstone project, I'd like to present the basic questions that I asked myself when thinking about teaching medical students about laboratory medicine. The first question, and arguably the most important, is why? As a pathologist, I know that I'm biased in my thoughts. However, when examining the literature, it is often stated that approximately 60 to 70% of medical decisions are influenced by laboratory medicine. However, less than 25% of medical schools offered either a required or elective rotation in laboratory medicine in 2014. My next question was what? What content would be included in this curriculum? What are the fundamental concepts in both anatomic and clinical pathology that our future doctors need, irrespective of their future specialty? When should students participate in these didactics? Should the learning be incorporated in the first 2 basic science-focused years or within the second 2 clinical years? And lastly, how would this curriculum be taught? While the limited pathology literature available focuses on pathology-based electives, integration into other clinical clerkships appears to be a unique approach that has not been previously reported. In collaborating with and under the mentorship of the faculty that I previously mentioned, we developed a twofold approach to introducing 3rd and 4th year medical students to fundamental concepts in pathology and laboratory medicine, including laboratory education that is both integrated into other clerkships as well as offered as a standalone remote elective in light of the current pandemic. Both modalities are grounded in a case-based, patient-centered approach. Progress made to date includes collaboration with the Departments of Internal Medicine and Pediatrics in the development of didactic sessions integrating high-value clinical care concepts, such as appropriate laboratory utilization. The remote laboratory elective proposal has been accepted by the Curriculum Evaluation Committee, and electives will be offered starting in August. Given limited abilities to conduct in-person didactic sessions, as well as the recent nature of the development of the remote learning elective in response to the pandemic, student data has not yet been collected for either teaching or approach. For both approaches, data collected will include qualitative narratives, quantitative assessments, as well as mixed approaches before, during, and after didactic sessions. Comparisons to evaluations of existing pathology electives will also be made. In conclusion, we've developed 2 unique strategies for incorporating medical student education in laboratory medicine into the curriculum. Further development and refinement of both approaches is necessary, and we look forward to collecting student data in the future. I would like to conclude with my entrepreneurial mindset. We started with curiosity, asking how we could develop a medical student curriculum in laboratory medicine. We investigated how other institutions have pursued this task and explored how we might incorporate novel formats of providing this education. We connected with stakeholders in internal medicine and pediatrics, and we need to connect with the Office of Educational Improvement in the further development of the remote learning elective. We are creating value in providing foundational knowledge in a unique way, and we look forward to measuring the benefits in the future. And now I'd like to conclude with my character artifact.